The anal canal is the terminal segment of the large intestine. It is the part situated between the rectum and anus. It is nearly 4 centimeters in length. It begins at the recto-anal junction, then runs downwards and backward. It ends at the anal orifice. Coming to the detailed anatomy of the anal canal. There are 2 anal sphincters. External anal sphincter and internal anal sphincter. The internal anal sphincter is the continuation of the inner smooth muscle layer and is involuntary in action. Whereas the external anal sphincter is made up of skeletal muscle, and is voluntary in action. The anal canal is divided into 3 parts according to its internal appearance. The first part and second part are approximately 1.5 centimeters in length. And the third part is 0.81 centimeters in length. These parts are divided by 2 lines called the pectineal line and the Hilton line. The first part of the anal canal possesses the simple columnar epithelium, which is the same as seen in the rest of the intestine. The mucous membrane forms 7 to 8 longitudinal columns, that meet on the lower part and forms a ridge-like appearance called the anal valves. Mucus-secreting anal glands open in the anal sinus, which are present in these anal valves. Anal valves together form a transverse ridge called the pectinate line. The middle part of the anal canal starts below the pectinate line. The lower end of the middle part is whitish. So, the line demarcating the middle part and the lower part is known as the white line of Hilton. The middle part is covered by a stratified squamous non-keratinized epithelium, and the submucosa contains dense venous plexus. That is why this part appears bluish in color. Anal columns, anal valves, and anal sinuses are not present here, and also, the hair, sebaceous, and sweat gland are absent here. Coming to the lower part. It is lined by true skin. Sweat glands and sebaceous glands are present here. The epithelium covering of the lower part is the stratified squamous keratinized epithelium. Now about the blood supply, nerve supply, and lymph drainage of the anal canal. Both morphologically and surgically are the most important landmark of the anal canal, is the pectinate line. It divides the anal canal into upper and lower areas. The anal canal below the pectinate line develops from the ectoderm. While above, the pectinate line develops from the endoderm of the hindgut. This developmental change has led to the differentiation of the blood supply, nerve supply, and lymphatic drainage of the different parts of the anal canal. The part above the pectinate line is supplied by the superior rectal artery, a branch of the inferior mesentery artery. The part below the pectinate line, supplied by the inferior rectal artery. Sensory innervation above the pectinate line is supplied by the autonomic nerves from the inferior hypogastric plexus. While, below the pectinate line is supplied by the somatic nerves from an inferior rectal branch of the pudendal nerve. The inferior hypogastric plexus gives a motor supply to the internal sphincter. The inferior rectal branch of the pudendal nerve gives motor supply to the external sphincter. Lymphatic drainage of anal canal. Lymph above the pectinate line drains into superior and middle rectal nodes. Lymph below the pectinate line drains into superficial inguinal nodes. Venous drainage above the pectinate line is by the superior rectal vein, and below the pectinate line is venous drainage by inferior and middle rectal veins. Superior rectal vein drains into portal veins through the inferior mesenteric vein. The inferior and middle rectal vein drains into the inferior vena cava through the internal iliac vein. Tributaries of the superior middle and inferior rectal veins form plexus in the submucosa and the adventitia of the anal canal called rectal venous plexus. So due to this connection between the portal vein and the inferior vena cava, the inner canal is the site of portacaval anastomosis. This concludes the anatomy of the anal canal.